My name is Rolanda Whetstone.
Hello, my name is Everett English. It was October the 8th, 2024, and I wound up spending about 3 months in here.
Mr. English came to us. He had a really severe infection. When he was stabilizing in ICU, he was still not acting himself, not speaking the way he normally does. So his admitting doctors that were taking care of him in the ICU ordered an MRI, and that's where we found that he also had undergone a stroke.
And at that time, it seemed like my world was coming to an end.
The therapy team evaluated him on that step-down unit and decided he's going to require some intensive therapy, and that was where the recommendation was made to be admitted to our inpatient rehab.
If you would have saw him when he first got out of the ICU, he couldn't eat, he couldn't sit up, he could barely talk. Although it looked bleak, I knew that he was determined, and I knew that he was a fighter.
I was his main therapist throughout his stay. This first probably 2 to 3 weeks, the brain has to get out of its fog. And we saw more of that probably a month in, and then building up on his personality. It was like, oh, I love this man. I couldn't wait to come up with something to work with him.
He came and told me, he said, Heather told me she was gonna get me back to where I once was. And he said, I believe that, and I'm gonna work, and I'm gonna help her all that I can.
Every day, again, it was like, okay, he can sit up a little bit better. Okay, he can stand up, a little bit better without having so much help. And that was just really cool. And then we just built on that every day and every week.
She challenged him. And Brian, he kept him on his toes and wouldn't let him quit.
My role for Mr. English was working on trying to improve his self-care, his ADLs. Working on his ability to use his left arm again. As he progressed, you started seeing personality come back, and he started interacting with the team. He kind of became just one of us.
It just seemed like the Lord was saying, like, I'm putting this healing into motion.
His ability to say, yes, I'm trusting you with my care. And when somebody is so willing to give everything they got every day, I got to do everything I can to get this man better.
I don't believe that he could have gotten where he has gotten if it wasn't for the people, the therapists, the nurses, everybody, because everybody was encouraging.
It's so rewarding to see where this man couldn't even sit up, and his true last day here, like he was able to walk with his wife with a walker.
That was just a start. And I knew that was just the beginning of our journey.
Mr. English touched all of us. He worked so hard with therapy, and that is why he obtained the results that he did. What we want patients to know are, you experience these symptoms, the quicker you can get here, the better outcome you will have.
Don't give up hope, because everyone here is gonna do everything in their power to get them to where they need to be. They're gonna be so much more than caregivers. They're gonna actually care for you.